I want to talk about how health insurance products evolved during the time I worked from United Healthcare from 2002 to 2020, and how these changes not just impacted customers but also employees. When I first started, the focus was on traditional HMOs and PPOs, plans that often only required a copay for services and maybe a referral. By the mid 2000s, United Healthcare started rolling out high deductible health plans. These plans were a game changer, but not in a good way. Here's how they work. In addition to paying a portion of your premium through payroll deductions, you also had to pay a deductible, often at least $1,000, before your plan even paid for anything. This is a huge burden to people who can't afford to pay these upfront costs. But guess who they tested these plans on first? Us, the employees. I remember how overwhelmingly disliked these plans were. People found themselves in worse financial situations, struggling to afford care despite working for one of the largest health insurance companies in the world. Employee satisfaction surveys often showed low ratings around the benefits they offered to us. Over the years, it only got worse. High deductible health plans became the norm for both employees and customers. The options available to employees were mostly, if not entirely, made up of these plans. The only exception to this, if you were at a higher salary grade level, you might have access to plans that had richer benefits. Imagine that, richer benefits for higher earners while everyone else was stuck with plans that made healthcare feel out of reach. This shift wasn't about improving healthcare or making it more accessible. It was about maximizing profits off the backs of both customers and employees. And it's just one more example of how the system isn't designed to serve people. It's designed to serve the bottom line. If you've ever struggled with high deductible health plans, know you're not alone. And to those in the industry, it's time to start asking yourself tough questions about the systems you're a part of.